is 5 on Your Side at 6. Focused on you.
It's a conversation that's long overdue. Leaders from across the bi-state met today to discuss a plan to reduce homicides in the region. Thank you for being with us. I'm Ann Allred.
And I'm Mike Bush. Leaders spent the morning at Washington University School of Medicine to get started on a regional strategy. 5 on Your Side's Travis Cummings joins us live from downtown to tell us what they're hoping to accomplish. Travis.
Mike and leaders at the regional summit say that they have been down this road before, and today was really an opportunity to get ahead of things. They say that they're going to be continuing to have these discussions so that they can clear out the crime in St. Louis.
What I haven't heard before is the true intentional focus on mental health and the whole person. We have to realize that crime is not something that we can fight in a silo.
To support that these individuals are now going to put behind a plan to get the city to where it needs to be. And it's not just about reducing crime, but it's also about saving lives.
That was my first question to leaders leaving out of the Regional Crime Summit at WashU Wednesday. What makes this discussion different? Greater St. Louis Inc. and the Regional Business Council invited leaders from across the bi-state to tackle what many are calling a public emergency in our region, deadly shootings. We've tracked 59 homicides in the city of St. Louis so far this year. The data's there.
I think communicating like this, being honest with each other in these things, and what are the things that we can do together.
What about the roots, systemic issues?
We talked about poverty and other root causes and housing instability and the like. And it was refreshing that we talked about viewpoints that oftentimes don't get brought up when you do talk about crime and violence and how to address it in our region.
Dr. Thomas Aft, who chairs the Council of Criminal Justice, broke down his focused deterrent strategy, focusing on the people and groups committing the crime, offering them the resources and a choice to do better or be reprimanded.
We need to treat this issue of community violence as a country with the same urgency that it's treated in the emergency room. We need to stop the bleeding.
The unity's there. Now it's time to get to work.
Give them the time and space to organize it and framework it out, and then let's put our hands on deck to execute.
Yeah, you know, we saw that united front during COVID when we were trying to keep our health under control. Can we use that same capability and resources to do it this time? Now, I did ask Mayor Jones, where do we go from here? She says that they're going to look at adapting to Dr. App's, some of his ideas. They're going to look at our data and how we can address this moving forward. We're live downtown. Travis Cummings, 5 on Your Side.